Hello, and welcome to the Antimicrobial Stewardship Project webinar series created by the Center for Infectious Disease Research and Policy at the University of Minnesota. I'm Dr. Marty Peterson, your host and outreach coordinator for the project. Today, we are very pleased to have Dr. Jennifer Granick and Emma Leof. Jennifer will present their webinar and their work together titled Improving Antimicrobial Prescribing in Companion Animal Medicine. We're very excited for her to present this work as we've not yet explored this topic in our webinar series. Additionally, a live question and answer session will follow the webinar where both Jennifer and Emma will be available to answer your questions, respond to your comments. So that gets my instructions for our participants that are continuing to join us. Welcome. And we want you to be aware that at any time during the webinar, you can engage with our speakers, and we want this through the chat box. All of your lines will be muted, but there's a chat box at the bottom right-hand corner, and please send your questions to all the panelists so we can address them at the end of the webinar. So back to our speakers. Jennifer Granick is an associate professor of small animal internal medicine at the University of Minnesota College of Veterinary Medicine. She received her doctorate from the University of Wisconsin and completed a one-year rotating small animal internship and small animal internal medicine residency at the University of Minnesota. She also received her PhD in comparative pathology from the University of California, Davis, where she studied the innate immune response of both hematopoietic stem and progenitor cells at the site of cutaneous Staph aureus infections. Her current research now focuses on clinical antibiotic use, including health informatics and antimicrobial stewardship. Her clinical service and teaching primarily focus on infectious diseases, including zoonotic diseases, as well as antimicrobial stewardship. Importantly, and a big part of the work she will be describing in her webinar is she's a member of the Minnesota One Health Antimicrobial Stewardship Collaborative, co-director of the co-director of the Antimicrobial Resistance and Stewardship Initiative, otherwise known as ARS, at the University of Minnesota, and chair of the University of Minnesota Veterinary Medical Center Antimicrobial Stewardship Committee. So she's certainly an expert on this topic, which is so terrific we have her today. Emma Leof has her master's in public health, and she's a program manager and lead epidemiologist for the antimicrobial stewardship at the University of Minnesota College of Veterinary Medicine. She holds her master's of public health degree in epidemiology and a Bachelor of Arts degree in physiology from the University of Minnesota. Prior to joining the university, she worked at Mayo Clinic and and at the Minnesota Department of Health. Her experience lies in surveillance design, research and analysis, and infectious disease epidemiology. And in her current role, she's working to advance antimicrobial stewardship in companion animal medicine through new research resources and research studies, and to establish disease surveillance system. And she's also a member of the Minnesota One Health Antibiotic Stewardship Collaborative. So two very strong experts on this topic, and we cannot wait to hear from you. So with Jennifer, I'll turn it over to you.
Thank you for the introduction and for the invitation to speak today. So the topic that we'll be focusing on today is how do we improve antimicrobial prescribing in companion animal medicine. So, and I will talk a little bit about why we think it's important to focus on companion animals in the larger context of antimicrobial resistance. So we're gonna touch really briefly on the problem of antimicrobial resistance, and then what we know about AMR and antimicrobial use in companion animals. And then one important way to address antimicrobial resistance is antimicrobial stewardship. So I'll explain briefly what that is. We'll talk about that specifically in the context of companion animal practice and what specific barriers there are to stewardship in companion animal practice, as well as some of the solutions that we as a group have come up with. So it's important to understand that antimicrobial resistance is really truly a One Health issue, which means that it's important to address this problem across all sectors in which antimicrobials are utilized, and that includes the environment, because oftentimes antimicrobials end up there. So just a really brief overview of what antimicrobial resistance is. As we use antibiotics, we have the potential to drive antibiotic resistance or antimicrobial resistance if we talk it in the larger context of all antimicrobials. And that's true whether or not we are using those antimicrobials appropriately or if we're not using those appropriately. So all use selects for and enables proliferation of resistant strains. And that happens in a couple of different ways. But as we use antimicrobials, say in an animal or a person, we kill off the normal flora, and that creates a niche for drug-resistant bacteria to sort of overgrow or take control. We also put pressure on those bacteria to develop new mutations that further drive antimicrobial resistance. And then once that resistance is present, animals and people can acquire resistant bacteria through different mechanisms. So that includes contamination in the environment, contamination of food and water, as well as direct transfer between animals, between people and between animals and people, and that goes both directions. So as I already mentioned, this is a One Health issue. So in humans, we know that antimicrobial resistance is a global problem. It results in over 7,000 deaths of humans worldwide from these resistant infections. In the United States, data from the CDC in 2019 shows that over 2.8 infections are credited every year, resulting in 35,000 deaths. And that's a huge cost to our healthcare system. And there are some predictions that untreatable antimicrobial infections, untreatable bacterial infections can be expected to surpass cancer as a leading cause of death globally by 2050. And we know this is a problem in animal health as well. There's certainly been a lot of focus on animal agriculture. And that's because agricultural animals do develop clinically relevant resistance. And that's important for animal welfare as well as food production. There's an impact there as well on people that potentially could have direct transmission of resistant infections between agricultural animals and people, as well as the risk of foodborne infections. But here I just want to pause and say companion animals should be focused on as well, because companion animals do share our environments. They are treated with antibiotics that are the same or similar to those that are important in human medicine, and they do eat meat-based diets. And then lastly, we need to not forget the environment. Here in Minnesota, there's been lots of research on antimicrobials in the environment, and antibiotics are found at low levels in lakes, rivers, streams, and urban groundwater. And if we look at lake sedimentary record for antimicrobials, we can see that this parallels antibiotic use pretty consistently. And so that makes it important when we're looking at this as a One Health issue to also remember that antimicrobial disposal is really important, because that can result in exposure in the environment. And as I said, we truly believe that the focus on companion animals in the context of antimicrobial resistance is important. And that's because in 2016, the American Veterinary Medical Association did some surveys and found that over half of all households in the United States have a pet, at least one, often more than one. And as I already mentioned, our pets receive medically important antimicrobials, and they're also a potential source of spread of antimicrobial resistance among animals, and then from animals to people and people back to animals as well. So that sharing of antimicrobial resistance has been documented in both directions. And I just wanted to highlight an interesting paper published in 2013 looking at the microbiome or the the genomes of the bacteria that live in and on the body. And in this study, they showed that if two adults are living in the same household, they share a little bit of their microbiome. If there is either a child or a dog in the household, then the amount of microbiome that are similar between those two adults goes up significantly. And so having a dog adds to bacterial diversity in the adults in the household. And that suggests that there's this sharing of the microbiota between all those household members. So there's certainly a lot of information regarding antimicrobial use and antimicrobial resistance in humans. So I just want to share, the little that we do know in companion animals. So there have not been very many large-scale studies looking at antimicrobial resistance, but this is one I'd like to highlight out of Europe. And I'm just going to focus in on some of the results from the UK because I think sort of their practice environment is similar to what we have here in the United States. And they looked at bacteria specifically isolated from urinary tract infections in companion animals. And in this study, if we just focus on E. coli, which is the most common bacteria isolated from the urine, we can see that up to a quarter of all E. coli isolates were resistant to all antibiotics on the susceptibility panel. Up to a quarter were considered pan-resistant, resistant to multiple classes of antimicrobials, and potentially only a half of those E. coli cultured were fully susceptible to all antimicrobials that would be on a susceptibility panel. So that's the story in Europe. And in the United States, we don't have as robust data, but just to give you a little bit of data closer to home here, in our University of Minnesota Veterinary Medical Center, several years ago, we looked at the sensitivity of bacteria isolated, E. coli isolates specifically, in patients in our community practice versus those in our intensive care unit. You can see that over a third of patients in the intensive care unit had multi-drug resistant infections. And so this is a problem that we see clinically in our pets, even here in the United States. Because we mentioned already that all antimicrobial use drives antimicrobial resistance, it's really important to look at how we use antimicrobials. And this study, again, is out of Europe. And you can see that there are a wide variety of antimicrobials that are used in companion animal practice, including a large chunk of use is in the penicillin, so amoxicillin with clavulanic acid. But there are also there's also quite a bit of use of fluoroquinolones, as well as third-generation cephalosporins and other antimicrobials that are important for human medicine, like trimethoprim sulfas, clindamycin, chloramphenicol, and metronidazole. So these are, this highlights that the use of antimicrobials in companion animals really is similar to the use of antimicrobials in human medicine. And so we really need to be paying attention. The largest study in the United States that evaluated antimicrobial use has been out of Banfield Pet Hospitals. They're a large practice group located geographically all across the United States, and they've actually produced two reports, one focusing on dogs and one focusing on cats. And just to hit the highlights here, they looked at the most common antimicrobials used in their practices, and beta-lactams were certainly up there, as well as fluoroquinolones. And that includes veterinary-specific fluoroquinolones, as well as fluoroquinolones that are really meant for human use, as well as third-generation cephalosporins, among others. The American Veterinary Medical Association has approximated that inappropriate use in companion animals is probably similar to that that have been highlighted by the Centers for Disease Control and Prevention in human healthcare. And the Banfield reports actually took a look at this. So there are a few published guidelines for how best to use antimicrobials in specific disease scenarios. And that includes respiratory infections, urinary tract infections, as well as canine pyoderma. And when they compared their use in the hospitals compared to what the guidelines suggest as appropriate use, there's quite a variety of how close practitioners are keeping to the guidelines, but you can see certainly in some cases, adherence to guidelines is quite low. So what can we do about the problem of antimicrobial resistance in companion animals? Well, there are certainly lots of tacks to approach the problem of resistance, including, evaluation of new diagnostics and new drugs, but simply improving the way that we use antimicrobials, also known as antimicrobial stewardship, is something that we can all do. So every single practitioner and every consumer of antimicrobials can have a part to play here. So I really like this definition of antimicrobial stewardship, so I'm going to read it to you. The primary purpose of stewardship is to optimize clinical outcomes while minimizing unintended consequences of antimicrobial use, including toxicity, the selection of pathogenic organisms, and the emergence of resistance. And so, this is a good thing, right? So antimicrobial stewardship is really aimed at improving outcomes for patients. And the Centers for Disease Control and Prevention have outlined 4 core actions to fight resistance. So that includes prevention of infection, tracking of infections, development of new drugs and diagnostics, as I already mentioned, but importantly, improving the way that we prescribe, and that is antimicrobial stewardship. So companion animal medicine is different than human medicine. For many, many reasons. One is that by and large, most veterinary patients, companion animals, have no health insurance. And so every diagnostic test that a veterinarian recommends really comes out of that pet owner's pocket. And that means that oftentimes we are limited in what we are able to do diagnostically or therapeutically. We also have while we do have some evidence-based protocols in veterinary medicine, they're certainly not as prolific as those available on the human side of healthcare. And natural behavior, whether we're talking about veterinarians or other providers, is that if we're not directly seeing antimicrobial resistance to a large extent in our practice, we might not think that our actions have much to do with the problem. And so and that's a hard mindset to change. But certainly, I think if we consider that the use of antimicrobials, even for that specific patient, if they're not needed, can have some detrimental effects, hopefully we'll change minds. And as I mentioned, this idea of antibiotic prescribing, especially in the face of diagnostic uncertainty, can become a really emotional decision for veterinarians. We are presented with patients and pet owners that have an immediate need. We often feel compelled to do something about that. And so if we are lacking diagnostics or a specific diagnosis, then oftentimes we are compelled to provide antibiotics just in case. And that is based upon this perception that antibiotics are safe and pose little risk to patients. But we know that that is not true. Certainly there are toxicity issues. And the more and more that we learn about the microbiome, the more that we understand that antibiotics, especially if they're used unnecessarily, and particularly in really young patients that are still developing robust microbiomes, can have detrimental effects. And in human medicine, certainly that field of science has far outstretched what we know in veterinary medicine, but we know there are consequences relating to the immune health, relating to gut health, relating to behavior even. And so there are consequences of unneeded antibiotics. And then lastly, in veterinary medicine, resources are lacking not only from the client side, but in a veterinary practice, we don't have a system where we can set up robust antimicrobial stewardship programs where we have one individual whose sole job is really focused on that. So there are financial and staffing limitations, but that certainly doesn't mean that there's nothing that we can do, and I'll get to some of the things that we can do as a profession shortly. I just wanted to share with you, again, some of this information about the idea of diagnostic uncertainty. And we did a survey in Minnesota. It was part of a national survey, but added some specific questions for veterinarians in Minnesota. And one question was asking whether veterinarians feel compelled to prescribe antibiotics in the face of diagnostic uncertainty. And do they feel that the risk of not treating outweighs the risk of treating? And 80% of respondents said that either frequently or sometimes that was true. They felt withholding antibiotics when we don't really know what's going on is perhaps more dangerous than providing antibiotics. And so certainly this highlights that improving diagnostics would be really helpful in our fight against antimicrobial resistance. But I'll highlight a few other things that we can do to help on this front coming up. So what are organizations that can support our efforts for antimicrobial stewardship? Well, the Food and Drug Administration recently released their 5-year action plan to support stewardship in veterinary medicine. And this action plan did include the companion animal setting. And so the Food and Drug Administration is focused on improving antimicrobial use, not only in animal agriculture, but in companion animals. The American Veterinary Medical Association has been quite active. They had a task force on antimicrobial stewardship in companion animal practice. They have released core principles of stewardship in veterinary medicine and defined what stewardship means in veterinary medicine. And they currently also have a committee on antimicrobials that is focused on all of these efforts. The Centers for Disease Control and Prevention also is focused on stewardship and does include veterinarians and information for veterinarians on their website and in their reports. And so also a really good resource. But here in Minnesota, I wanted to highlight a couple of resources that we have. So one is the Minnesota One Health Antibiotic Stewardship Collaborative. And this is a collaborative that is housed in the Department of Public Health, and I will talk to you a little bit more about that in a second. And the other is out of the College of Veterinary Medicine at the University of Minnesota, our newly established Antimicrobial Resistance and Stewardship Initiative. And we have compiled lots of resources and are continuing to develop new resources in the effort to support stewardship practices in companion animals. So the Minnesota One Health Antibiotic Stewardship Collaborative, or as I like to refer to it, MOHASC, has a vision of uniting leaders in human, animal, and environmental health with the aim of raising awareness of antimicrobial resistance and focusing on improving behaviors so that we can preserve antibiotics and treat infections effectively across all health sectors in Minnesota. And this is a really unique group. It involves personnel from state agencies, those from the human health care profession, including those focused on inpatient care, outpatient care, long-term and nursing care, dentistry, pharmacy, veterinary professionals, both large animal, food animal, and small animal, folks from all across the university and industry, as well as pharmaceutical companies. And we meet once a year as a large group. We also have several different working groups. I'm part of the animal health working group. There's a One Health working group, there's a human health working group, there's a working group that's focused on the environment, and a group that's focused on essentially education and outreach. Anyone is welcome to join this. In fact, we encourage more folks in Minnesota to do so. The more members, the more ideas and the more progress that we can make. And if you're looking to find, the URL for this is quite long. So whenever I'm trying to find the website for MOHASC, I just Google Minnesota One Health, and it's usually the first thing that pops up. There's an opportunity on the website to sign up for newsletters. And then if you're interested in joining, then you can find out more information there. Out of MOHASC grew this University of Minnesota Antimicrobial Resistance and Stewardship Initiative at the veterinary school. So the primary founders of this initiative are myself, Emma Leof, who you were already introduced to, and Amanda Bedoin, who directs MOHASC at the Minnesota Department of Health. And we have attempted to create a place for you to essentially find everything that you need about antimicrobial resistance as well as stewardship resources for companion animal medicine. And if we're missing anything, send them our way. We'd like to include them. And in addition to providing education and resources for companion animal veterinarians, we also aim to conduct research to advance the knowledge of companion animal diseases and treatments with the main focus on antimicrobial use, antimicrobial resistance, and stewardship. And so you can see at the bottom of the screen, our website is pretty simple, arsi.umn.edu. And so RC has produced several tools for antimicrobial stewardship, and that's what I'd like to focus the rest of the time on sharing with you. So we've just published the Handbook of Antimicrobial Stewardship in Companion Animal Veterinary Settings. It's the first of its kind comprehensive guide for implementing the AVMA core principles of antimicrobial stewardship. And I mentioned that addressing antimicrobial stewardship is really a One Health issue, and so requires a One Health approach. And so we did look to similar guides that are available in human health care to help us strategize how best to provide resources and guidance for companion animal veterinarians. So we have strategies and tools that we've organized in this handbook into basic, intermediate, and advanced levels. So even if you don't have a lot of resources at the practice level, there's still probably something small that you can do and then build upon that in the future. And so we truly believe that stewardship in our unique companion animal setting needs to be a stepwise approach. And so we've organized the handbook in that way. And then we have a series of checklists. This is the advanced checklist for initiatives that you could take in your practice, but excuse me, you can see that the basic level does not have as many actions to take as the intermediate or the advanced levels. And so these actions can really build upon themselves. And then when and if resources and time become available, there are certainly more and more actions that we can take to create a more robust stewardship program. But we have organized the handbook based upon the core principles of antimicrobial stewardship that the American Veterinary Medical Association has outlined. And so the first of those is to commit to stewardship. And so this may seem silly, but when I was thinking about this, I really thought about this book that we have in our house that I read to my kids when they were little about this otter who is learning to swim. And so the advice this otter gets is to just start small, and little by little, the otter will be able to swim. And so that's the approach that we have in mind when we're talking about building stewardship programs in companion animal practice. So if we were to take one small step in our practice, the first step would be to commit to stewardship, and a simple step there is to post a commitment poster in the lobby. There's pretty good evidence in human medicine that making this sort of commitment and making it publicly to clientele really creates accountability, so that if you say to your clients, I am committed to using antimicrobial resources wisely, and you say that when they walk into the lobby, then you're more likely to adhere to those principles when you're in the exam room. There are a whole host of other resources under the core principle of commit to stewardship available, linked in the handbook and also available on the RC website. And those include templates for emails to introduce your commitment to stewardship to clients and to the other veterinary staff in the hospital. But really the simplest first step to take is just to stick your picture on a poster and put it up in the lobby. The next principle is advocate for a system of care to prevent common diseases. And so this is something that every veterinarian is very familiar with, right? Infection prevention. And so one simple step to take towards prevention is to utilize one of these posters from the Minnesota Department of Health that highlight the importance of hand washing. I know everybody in the midst of our current pandemic is is probably doing a much better job of hand washing than we used to. There is also a resource available created by the Veterinary Medical Center that gives specific precautions and infection control guidelines for different diseases that we commonly encounter. And so utilizing one of these resources can be a simple step to take towards improving prevention in the hospital setting. As well as the AHA infection control, prevention, and biosecurity guidelines that were published in 2018. It's a really user-friendly guide to improving infection prevention and control in the practice setting. And then lastly, and I mention this because I think that many people are not aware that the National Association of State Public Health Veterinarians does provide a compendium for veterinary standard precautions for disease prevention. And it's a really robust tool, and we have links to that on our website and also through the handbook. The third core principle of stewardship is to select and use antimicrobial drugs judiciously. And I already mentioned that we do have several guidelines available for companion animal practitioners that are disease specific. And these were created by the International Society of Companion Animal Infectious Diseases, or ISCAID. And if you don't know about ISCAID, remember this website. It's really easy, iscaid.org. Check it out. They have links to all of their really fantastic guidelines that are freely downloadable on their website. We also have links to these on our website and through our handbook. But these provide excellent guidelines for not only treatment of common diseases, but the diagnostic approach to them. So super helpful, very meaty. And one of the things that all of these highlight is that we should be thinking about our antimicrobial use in terms of tiers or lines of therapeutics. And so first line drugs should be drugs that we feel comfortable using as empiric therapy, and not sort of, to use a commonly used term like bigger guns. They're drugs that are effective at treating infections and minimize the risk of creating multi-drug resistant organisms. RC has taken all of those guidelines and tried to distill them down to 2 sides of a sheet, which really doesn't do all the information in those guidelines justice, but is a nice reference, again, highlighting the empiric drugs that we should use as first-line agents in all of these disease settings. Another thing that we highlight on the pocket card, as well as are highlighted in the guidelines, is that for some infections, we really don't need to institute antimicrobials right away. Similar to humans that have a common cold, we usually don't have a cold and run to our doctor for antimicrobials. We know that's a viral infection. And in fact, most snotty cats, that's the same. It's not the cold, but it's a viral infection. Dogs with a cough that are otherwise healthy often don't need any antimicrobial intervention. Your run-of-the-mill diarrhea. I have a Labrador retriever that will scarf things on a walk and then get diarrhea for a few days. And probably antimicrobials are not necessary in that setting because they'll either resolve on their own or there are non-antimicrobial ways of addressing the condition. And so we've created based upon a similar document from the British Small Animal Veterinary Medical Association, just a template that we can provide positive action for pet owners that are seeking care for these common diseases when we don't think antimicrobials are needed or not needed right now. So this idea of watchful waiting, let's see what happens, try these other interventions, and if the disease gets worse or doesn't resolve, then come back and see us, and at that point, maybe antimicrobials will be necessary. So this is available linked through the handbook as well as on our website. Okay, so the fourth principle is to evaluate antimicrobial drug use practices. And so this is an area of research that RC is focused pretty heavily on. And we have taken a few different approaches, what we call a low-tech or manual data collection approach and a high-tech or electronic or digital surveillance approach. So the first is a point prevalence survey, and that's really just collecting data at one point in time and looking at what a practice is on one day is. There's really minimal equipment or technical expertise needed. It doesn't matter if you have an electronic or a paper medical record system, just need some time and effort to do the data collection. We have some additional information about this on our website. We've also recently created and uploaded on our website an Excel-based tracking tool. So if you're familiar with Excel, it's a pretty commonly used spreadsheet software. We've created a tool that can be used in a practice setting to keep track of antimicrobial use, and I'll talk about that in a sec. The more high-tech approach is to extract data directly from electronic health records and then put those into a database that we can evaluate for large trends in antimicrobial use or disease processes. In order for something like this to work, it really needs to be passive on the part of the veterinary clinic, but there's a lot of technical expertise needed on the data analysis side, and that's something that we aim to do in our Companion Animal Veterinary Surveillance Network, and I'll talk about that in just a sec. So we did take a point prevalence survey approach at the University of Minnesota Veterinary Medical Center, and I won't get into all the details. What we did was we did a point prevalence survey one day a month for a year, and we evaluated antibiotic use in our core services: medicine, surgery, emergency, primary care, urgent care. And it was really nice to look at this data because it highlighted a few areas where we can maybe dive back in and evaluate whether or not practices need to change. So one thing for me that I felt was important that we recognize is that there's quite a lot of prescribing for diarrhea in our outpatient settings. We're using a lot of metronidazole, and almost all of it in the outpatient setting is for acute diarrhea. There's some information that's growing that suggests that not only do we not need to use metronidazole, but it potentially has impacts on the microbiome. And so that's something that we are currently looking a little bit more deeply into to determine if we need to change our approach. We also recognize that our fluoroquinolone use in the outpatient setting is quite low, but in the inpatient setting is quite high. And so that's an area that we might want to reflect on as well. I mentioned large data collection electronically, and the University of Liverpool has been doing this for over a decade using their small animal veterinary surveillance network. And they currently have over 500 UK clinics enrolled. They have millions of patient records that they can extract data from, and they have automated these data extraction algorithms so that they can look at data in near real time. And the veterinarians in the practices that are part of SAVSNET require less than 6 seconds of their time per patient that they see. So it's really valuable. Some of the things that SAVSNET has produced, and this is just, they've produced a lot of data, but this is just one area to highlight, is focused on antimicrobial use. And you can see that in cats, there's quite a lot of third-generation cephalosporin use. In dogs, not as much. And so that's, it really just highlights that big data can identify targets for practices to take a look at and potentially change the way they're approaching their patients. Other things that a surveillance network can do is to describe antimicrobial resistance patterns in large populations, and then provide clinics with benchmarking so that they can compare their practices against those of their peers, as well as see how their practices change over time. And SAVSNET has this all available as a dashboard interface for the practices that participate. And so what we aim to do at RC is to replicate a companion animal veterinary surveillance network similar to SAVSNET. We've been working with them to do just that, and so you will likely continue to hear more about that as we are in the development process, and we hope to start recruiting practices into what we are calling CAVSNET pretty soon. And then lastly, I mentioned an Excel tool. And so sort of in the meantime, before we can have practices participate in CAVSNET, this is a really simple Excel spreadsheet. You simply enter patient data and antimicrobial use data in it. There's one line per patient, and you can do this one day a month if you want. You could do it 1 week a year, whatever is appropriate and you have time for, but as you accumulate data, all of these charts and graphs are populated automatically within the Excel tool, so you can get a good idea of what your prescribing practices looks like. And so lastly, the core principle, educate and build expertise. So we have resources for that as well. MOHASC has developed a series of fact sheets that are helpful to provide to pet owners so that they understand a little bit more about the problem of antibiotic resistance. We have some talking points that are useful. So it's, you know, if you're going to change your approach to how you discuss the use or withholding antibiotics in the exam room, there's some strategies that can be more helpful. So providing information about why antibiotics are not needed and some positive treatment recommendations instead of just the statement that you're not going to prescribe something, what other things can be useful. And so sometimes just getting some tips on how that conversation can go can be helpful. There's a whole host of other educational materials, including webinars on our website as well, and they're linked through the handbook. So, so what can you do if you want to be part of this addressing antimicrobial resistance in companion animals? Utilize already existing resources. And that's one of the things that we really started doing as RC, is saying, you know, there's a ton of resources available. Let's put them in one place so it's easy for us to find and make that available to everyone. And then we continue to try to make easily accessible and easy to use resources based upon the information that we have on best practices. Take a stepwise approach, little by little, just one small step at a time. Printing out a commitment poster is a positive action, doesn't take a lot of effort, but can make some significant differences in your practice. And once you've successfully done that, and it feels good, it might be motivating to take another step. And that's exactly the approach that we're taking at the Veterinary Medical Center to try to improve our antimicrobial prescribing practices. Continue to educate yourselves about AMR and antimicrobial stewardship. Participate in research. And so we'll be putting out calls for enrollment in our electronic health surveillance network, as well as a national point prevalence survey in companion animal practices, both referral and primary care practices coming up in the next year. So with that, I just want to say thank you all for your attention, and Emma and I are available for any questions at this point.
Excellent, Jennifer. Thank you so much for the overview of all the work that you've been conducting, and the programming that's gone into this to start to get at this data. I encourage our attendees to stay on, because we've got also Emma joining us for the Q&A session, and we have already some very interesting questions that have come in for both of you. One of the questions is, Jennifer, do you have plans currently for monitoring the implementation of the steps that are outlined in the handbook and private practices? Is there a way with your surveillance?
Yeah, that's a wonderful question, and that's our hope. Certainly, we hope that with the electronic surveillance, once we have that implemented, we'll be able to look at benchmark indicators of antimicrobial prescribing. And I should mention that that network is not just useful for looking at this topic of antimicrobial stewardship. It's really an important companion animal health surveillance network for all sorts of disease processes, but because this is our primary interest, that's sort of one of the first things that we'll use it for. So we can look at benchmark practices, and then as there's more uptake of antimicrobial stewardship practice in clinics, we can look at how those benchmark, we can compare changes to those benchmarks. So we can see how prescribing changes over time. We can, in the Excel spreadsheet that we have, a practice can do this sort of on their own. And one of the charts in there is to look at watchful waiting. And so how many times are you encountering patients with acute diarrhea that you prescribe, and if you focus on that as one of the first actions in your stewardship plan, how does watchful waiting increase and the use of metronidazole decrease in your practice? So certainly looking at the data is helpful. Veterinarians are really data focused, and so that's why part of our initiative is to focus on that. So that's those are two ways, and certainly with a point prevalence survey, we're aiming to do that as well, to get sort of a national idea of what antimicrobial use is, and then look at that again several years down the line and see how that changes.
Great. And that was a question that is completely related when you bring up the gastrointestinal infections and use of metronidazole. One question was, is there any current evidence that you could point the clinicians to that this is prescribing metronidazole is or is not useful for resolution of the diarrhea? It's a contested topic.
Yeah, that's a really good question, and currently it's not compiled in any sort of guideline, but you certainly are. If I can send papers, if you email me, so because I can't cite all the authors off the top of my head, but I will say that yeah, there's a recent paper that looks at metronidazole versus placebo that was published in the Journal of Veterinary Internal Medicine, and it shows there's really no difference in outcome. There are papers out of Texas A&M that look at dysbiosis associated with antimicrobial use, including metronidazole. There are other papers that compare metronidazole and prednisone, so now not acute diarrhea, but chronic diarrhea in the context of inflammatory bowel disease. So prednisone and metronidazole versus a probiotic, and outcomes as far as clinical outcomes and histopathologic changes were similar between those two protocols. So it does speak to sort of like the power of the microbiome. What we do know is antimicrobials have a longer lasting effect on dysbiosis. So even if there's clinical improvement, if you look at the level of the microbiome, there are longer lasting changes that we see if you go from a stable microbiome that there's something that changes. You have acute diarrhea if you give antimicrobials versus not. Sort of the dysbiosis lasts a bit longer, even if it's not clinically apparent. And I think that's important because as we learn more about the microbiome, we understand the effects on other systems in the body, including behavior and the immune system.
Great. Thank you, Jennifer. And it sounds like that you're completely open to having any of our attendees with other pressing questions email you as you've got your email address at that website, on the slide there in front of you.
Yes.
Just taking you back to the beginning of the presentation, and Emma, we'd like to hear from you as well. It seems that you're trying to collect surveillance data, but then of course it's understanding use as it correlates with resistance. And the EU is starting to get at, you presented some studies, whether it's the UK, or maybe in Europe, they're starting to get some more comprehensive data. How might we be able to do that in the US? What do you feel needs to happen?
Emma, do you want to take that one?
Well, I think one of the main ways that we're trying to do this is through the Companion Animal Veterinary Surveillance Network. So they also collect lab data at the University of Liverpool. So they are able to look at resistance through that way.
Right. Because that's a piece where you need, if you understand practices, but then you also need to understand some of the resistance patterns that you're seeing. So it even gives a more compelling case of why should we do this in the first place. So back to some of our other questions. I think this question was getting at pet owners having access potentially to antimicrobials that maybe aren't necessarily prescribed. So they're wondering about just kind of that as you have materials available to promote antimicrobial stewardship, but it also facing outward to the custodians of those animals as well.
Yeah, so in veterinary medicine, there is a requirement for a valid veterinary client-patient relationship for any prescribed drugs. Antimicrobials need to be prescribed, but that's not to say that you know, one of the issues in veterinary medicine is this idea of antibiotic duration. So what's the appropriate amount of time that a pet needs to be on an antibiotic to recover from an infection? And we don't have a lot of data. We have more data than we used to, particularly in lower urinary tract infections. But many times we are sending patients home with probably longer prescriptions that are needed. And because, you know, for me, like, pilling my cat is difficult, I probably have never given her a full course of antibiotics, you know, prior to becoming a veterinarian. And so I think that, you know, there's the possibility that those extra pills are at home, and certainly we do see sometimes clients start them when they start to see the clinical signs come back. But by and large, the only way that they have those drugs in their hand in the United States is through a prescription from a veterinarian. So, but it does bring up the point that the education is not only for us, you know, veterinarians need to be educated about these things and critically evaluate the way we practice and continue to hold each other up to higher and higher standards. I mean, that's the way our profession has always been and will continue to be. This is why we grow as a profession. But we also need to provide education to our clients, and we are really well seated to do that. I mean, because of the way that, you know, everything that we do comes out of a client's pocket, there's a lot of discussion, a lot of client education, and so this just needs to be another part of that.
Yes, and another follow-on question that's similarly related is just around not having accessibility via the diagnostic, from the veterinaries in the clinic's perspective. If there's a lack of culture data and they don't really have antibiograms to operate from, perhaps there's a lack of apathy towards stewardship, like knowing if they implement these practices, are we having a positive impact?
Yeah, that's really important. So the cost of doing culture and susceptibility testing is certainly one barrier in companion animal practice. And then beyond that, when it is done, what does the aggregate of that look like? And so that's one of the things that we can do with big data. As Emma said, you know, the hope is to, similar to what they're doing at the University of Liverpool, is to involve veterinary diagnostic labs so that we can give people that, that type of data. And collated susceptibility data, you know, is important to look at sort of at that larger level, national level, just so we can say, hey, this is a problem. But antibiograms really need to be as specific as possible. So site specific, species specific, and then specific, you know, in human medicine, they can be specific to an ICU unit on a particular floor in the hospital. So as specific as we can get them, the more useful they'll be. But we do at the Veterinary Medical Center, we do create yearly antibiograms. And one of the most important things that I think it's useful for is tracking change in resistance patterns over time, because that does create situational awareness. And for me, helps me to decide how much I should push spending that extra money to do the culture and sensitivity testing.
If a group was wanting to do one of these point prevalence surveillance studies, is there a best time to do them, or, you know, do you have some guidance on timing and who to involve?
So we've looked at in our own hospital. So we kind of use the Veterinary Medical Center as our pilot. And we did a point prevalence survey monthly. And when we looked at data over 6 months versus data over a year, it was largely the same as far as percentages, but there likely is seasonal variability. So there may not be one best time to do it, but I think if we're trying to look at changes over time, the idea would be if we did it, say, in September, you know, nationally, then when we repeated that in the future, we'd probably want to do it the same time. We are also piloting a point prevalence survey in primary care companion animal practices in Minnesota and Northeast North Dakota, and we're doing that quarterly to try to get some of that same information.
Another follow-on question is, the organizations that support stewardship and the companion animals, thinking more globally, do you also have engagement with the World Health Organization? Are there other global groups that, one question was basically, is there a reason why you did not mention the World Health Organization? Are you thinking more, you know, just there's global programs, but couldn't cover them all?
Yeah, no, I can't cover them all. I mean, obviously, the World Health Organization is really important. I mean, the World Health Organization raised the alarm. I think part of their sort of call for action was what prompted the development of the Presidential Advisory Committee on combating antibiotic-resistant bacteria here in the United States. Which has done a lot of great work, and I didn't mention them either. So there are a lot of groups working on this, and I think the important thing is to try to open the conversation up amongst as many of those groups as possible to share resources, to share information, and to share ideas. So we could, you know, it's a One Health problem. And it's a big problem, and so the more heads we get in on it, the better.
Does the Minnesota working group have involvement with the at the federal level with the Presidential Advisory Council?
So there have been members of the Minnesota One Health antimicrobial or antibiotic stewardship collaborative that have served on that committee at the level. Both Amanda and I have spoken at one of their meetings, and so you know, there has been interaction with that group. Yep.
Great. Back to your tools that you mentioned that are available through the Antimicrobial Stewardship Initiative. Are you tracking, and maybe Emma's part of this as well with doing the surveillance work, how many, it's almost like a campaign so that they know the tools available, and then tracking how many are currently using it? Or do you have a goal for enrollment in these types of tools and aggregating that data?
Emma, do you want to take that?
Yeah,
So
Emma.
The Minnesota Point Prevalence Survey, that was just open to Minnesotans, but we did advertise it to all licensed veterinarians. So anyone was welcome to participate. They all have access to the resources, and we do plan at the end of the 4 quarters of data collection, providing that suite of resources and providing them their data back to them. That it is kind of a unique situation where we will be giving them directly their information back to them summarized.
Yeah, and I guess as far as utilization of the other resources, I mean, we can get sort of web traffic information, so we can identify the number of people that download resources. But we've been trying to, if anyone has ideas, we would love them, first of all. But we've tried to provide the pocket guides at the Minnesota Veterinary Medical Association meeting for free. You know, at this point, we don't have a specific way to understand who's utilizing the resources that we have on the website specifically. And that may be something that we need to think about in the future. And if anyone has ideas, we'd like them.
Are there other collaborative efforts with the veterinarians around that they could send particular samples to the laboratories at the university to get sensitivity testing done and have that data, build that data as part of your database?
Yeah, that's a really good question. And right now, that's not something that's available. But that is something that we hope in the future will be. The SAVSNET, which the Small Animal Veterinary Surveillance Network in the UK, has progressed to the point that they can identify outbreaks of disease in areas sort of in real time. There's a really great example of this that started in the winter of this acute vomiting syndrome in dogs. They were able to see that trend in their data, engage with veterinarians that are part of their network, and they were actually able to get samples and identify the virus involved. And so we hope to be able to do something like that in the future. You know, we have big goals. We got to start somewhere, little by little, right?
Absolutely. Yeah. I noticed something early on. You mentioned the data that you've collected from your Minnesota small study. I believe it was back on slide 8. But showing the differences from when you looked at from E. coli isolates, your multi-drug resistance from your community practices versus the ICU practice, which was pretty significantly different. And you probably know what type of resistance to what antimicrobials that was driving some of that. But is that just tied specifically to the use of the antibiotics in the ICU, or what was driving?
Yeah, I mean, that was that's data that was collected a while ago by Dr. Jeff Bender, and so and I don't think he's on here, otherwise I'd make him give us some more information. But it, just to illustrate that this is something that's happening here, right here. But as far as differences in resistance between community practice and hospitalized patients, I think that's a trend that we see in human medicine as well. It's probably related to sicker patients receive more courses of antimicrobials and therefore are more likely to have resistant infections. So certainly patients come into our ICU with resistant infections. They don't necessarily get them there. And that study did not evaluate hospital-acquired resistance versus community-acquired.
So you're saying they could be at your ICU and had multiple courses of antibiotics before they arrived because they've got some sort of complicated problem.
Yeah.
But it's interesting to track. I guess we're almost out of time, but I'm curious as to, it seems like there's a lot of parallelisms between stewardship in human health and stewardship in companion animals. A lot of correlates. So just closing remarks on where you'd like to see, like just some of your top line goals maybe over the next couple of years in this field.
Yeah, so I think, thank you for that question. Yeah, there are a lot of parallels. And so that's really helpful for us because there are, flag posts that we can try to attain. One of the big aims that we have is to get our electronic health surveillance network up and going. But because that takes a lot more time and resources, we're also moving forward on sort of the less technical front of antibiotic use data collection. So we'd like to continue to increase awareness to try to continue to gather data about antimicrobial use and make actions towards stewardship easy and accessible as possible. So I think those are our main goals.
Excellent. Yeah, like you said, you're starting small, and then you got to start somewhere and grow your network from there and create the awareness. There's many questions, Jennifer and Emma, that we were not able to get to or answer. So I apologize to our attendees and participants, but very robust Q&A session here. So please feel free to reach out to Dr. Granick or Emma Leof. Their emails are in front of you there, or you can find them at the University of Minnesota College of Veterinary Medicine. So with that, I unfortunately have to conclude our outstanding webinar and end the Q&A session. I wanted to thank both Jennifer for speaking to us today and Emma for participating in the Q&A session, and also for all your great really groundbreaking work in this area. And I also want to thank Maya Peters, who's also on this session with us. She's part of our CIDRAP Antimicrobial Stewardship project team, and she's instrumental in the planning and production of the webinar. And finally, thank you to our attendees. Please visit our website. This webinar has been recorded and will be available at our website at cidrap.umn.edu/ASP. And reach out to us, sign up for our newsletter, or email us about other topics. Perhaps you want more of this topic as well, and we can get some additional speakers or invite Dr. Granick and Leof back for more. Thank you so much.
Thank you for having us.
Thank you.